Hey guys, Ben here, and in this video I'm going to do a little comparison between PAs and NPs. What are the differences? Do the differences matter? Are there any major pros and cons of being one versus the other, and so forth. Little background, I'm a PA and I've worked in the emergency room, family practice, urgent care, and I've worked with a lot of nurse practitioners, and I know several, and I've talked to them a lot about their careers and so forth. So I have personal experience with the PA and a lot of kind of close experience with nurse practitioners. So what we'll do in this video is go over kind of the education, how you become a PA and an NP, and then also what the job is like, what are the responsibilities, are there differences between the two, pay, opportunities, and any other pros and cons or just significant differences between the two. So let's start with the education. So how do you become a PA or how do you become an NP? So I am a PA, as I mentioned, and what you do to become a PA is you start by going to college. So that's like 4 years. You do your bachelor's degree and you take the prerequisites while you're there. So a lot of people do a major like pre-med or biology or something because that includes a lot of those prerequisites. Prerequisites are the classes you have to take before you can apply to PA school. And there's a list of them for any school that you might want to apply to. So take a look at that. But it's like biology and physics and chemistry and other things. So you do that, and then after you're done with college, usually you have to get some kind of healthcare experience, maybe a year, give or take, in order to be able to apply to PA school. So take a look at the school. Each school will have their own requirements, but you could work as a paramedic or a medical assistant. You could do some kind of volunteer work, or there's a bunch of other possibilities. Mine was really weird. I actually was in a different school, podiatric medical school, and I did some clinical rotations, and that was my healthcare experience. So totally different. You probably never meet anyone else that's done that, but that's the next step. And then after you get your healthcare experience, then you apply to PA school. And you go to PA school, and it lasts about 2 to 3 years, depending on which program you go to. So if you add all that up, 4 plus 1 or 2 plus about 2, so you're looking at maybe 7 or 8 or 9 years total to become a PA after high school, once you start college. So that's the path to become a PA. And it's quite competitive to get into PA school these days, I know. I'm not sure how competitive NP school is, but let's talk about it. So to become an NP, the difference there is the first thing you do is you become a nurse. So how do you become a nurse? Well, you go to a nursing program, and from what I understand, those range from about 2 to 4 years, if it's an associate's degree or a bachelor's degree. So you can become a nurse a little more quickly initially versus getting your bachelor's degree, possibly if you go to depending on what college you go to. So anyway, you become a nurse, you work as a nurse, so that could last a year or 2 or more, and then you apply to NP school and you go to NP school. Now, one difference that I've noticed is that it seems to be more common for nurse practitioners to continue working as a nurse while they're going to NP school. And one reason is because it seems to be more common for them to do a remote program where they can take the classes in California, even though the school's in New York or something. That used to be really uncommon for PAs. It's probably a little more common now post-COVID and all that. But anyway, it's a little more common for nurse practitioners to keep working, keep earning money, even while they're going to NP school. So that's kind of an advantage on the schooling track, even though it might make it harder to learn everything. It's an advantage financially, at least, for them. So that's how you become an NP. And if you think about it, it takes about the same amount of time either way. Because if you add that up, it's something like, let's say 4 years to become a nurse, 1 year working as a nurse, and 2 years doing NP school or something like that. So that's 7. So you could probably become a nurse practitioner a little bit faster than an NP, but most of the time it takes about the same amount of time. All right, so that was the education. So what about job opportunities? Is there any significant difference in the job opportunities as an NP or a PA? Mostly no. Mostly it's the same. But the one reason there could be a difference is because as a PA, I can work in just about any specialty, and I can work with any age, like kids or adults. But some nurse practitioners can only work with adults, and there might be some who can only work with kids. So it's kind of split up by age sometimes, and that's just because they went to a certain school or went on a certain track to become an NP, where they then become like an adult nurse practitioner or one who treats adults. So I'm not an expert on that, but I've talked to some, and I know that if some nurse practitioners can't work with kids and maybe vice versa. So you got to pay attention to that when you're doing your NP program if you're going to become an NP, just in case you don't want to be limited to certain age groups. But leaving that aside, pretty much the job opportunities are the same. Once in a while, there's a certain clinic that prefers PAs or prefers NPs or what have you. They'll have their own reasons, but most of the time, it's pretty much interchangeable in terms of the job opportunities. So what about the job responsibilities? Once you become a PA or an NP, is there any difference in what you do? For example, in the ER where I work or family practice where I used to work or anywhere else? Well, where I work and the places I have worked, there is no difference. It's 100% exactly the same. So you would have no idea who are the PAs and who are the nurse practitioners if you just kind of watched what they're doing and tried to figure it out. You wouldn't know because we do exactly the same thing, 100%. But I'm sure there are some places where it becomes slightly different just because, if we have a slightly different background, different skill set, somebody might ask you to do something a little bit different. But in general, the job responsibilities are the same. So that once you become an NP or a PA, it doesn't really matter which one you are when you're doing the job. What about autonomy? Do either PAs or NPs have more autonomy to be able to make their own decisions and just take care of the patients without having to always talk to the doctor, et cetera, et cetera? Well, for the most part, no. For the most part, it's also the same. But there is a caveat, and that is that nurse practitioners have a little more lobbying power. There's more nurses out there, and then somehow they get some laws passed in their favor that say in certain states, nurse practitioners can practice without having a supervising physician. I don't think there's any legitimate reason for that. It's probably just lobbying power. So the end result is there are maybe certain clinics that are started by nurse practitioners where they kind of have more autonomy because they don't even have a supervising physician, or other settings where that ends up being the case. In real life, most of the time, we have pretty good autonomy, though, and I'm mostly making decisions, especially outpatient. When I was doing family practice, I wouldn't talk to the doctor unless I felt like it. In the ER, I do talk to the physicians I'm working with pretty regularly, but so do the nurse practitioners that I'm working with, so there's really no difference there. Just in that kind of setting that I talked about where maybe a nurse practitioner has a certain clinic and they don't even have a supervising physician attached to their name or anything like that. All right, so let's talk about pay, compensation. Is there any difference in how much you earn as an NP or a PA? Generally speaking, no, it's going to be exactly the same or very similar. But again, I mentioned there are some differences in the practice settings, like if that nurse practitioner goes and starts their own clinic, then obviously they might have a little bit of a more of an entrepreneurial opportunity or something like that, and where they might ultimately earn more money. But if you just go get a job, you can expect to earn about the same amount of money. All right, so in conclusion, are there any important differences between NPs and PAs? Not much, as you can see, other than, make sure you're not limited to just adults as an NP if you want to work with kids or vice versa or whatever. But other than that, it's pretty much the same thing once you get there, and you pretty much do the same thing, earn the same amount of money, et cetera, et cetera. All right, so hopefully that was helpful. If you want to hear more questions answered about the PA career and other related things, go ahead and subscribe to my channel right here, and I'll put another video or playlist or something for you here that I've worked on recently. Thanks for watching. Till next time.